Hello, and welcome to our short video about Bleach Bright Pro. Today we'll be reviewing the main advantages of using Bleach Bright Pro in your practice and the protocol to follow when marketing and administering it. The Bleach Bright Pro system is a 3-in-1 teeth whitening and oral hygiene product that you and your patients will love. It consists of an in-office whitening using our exclusive BB Cool Advanced LED Whitening Light, an at-home instant impression mouthpiece and gel for maintenance, and an on-the-go whitening and enamel strengthening pen. It's the most comprehensive whitening system available, and it will whiten your patient's teeth 2 to 8 shades in the initial office visit and allow them to maintain their white smile for as long as they are using the maintenance products. Your patients will love Bleach Bright Pro because it's quicker and easier with zero sensitivity. They'll also love the fact that most dentists offer Bleach Bright Pro for less than other in-office whitening products. As a dental professional, you'll love the fact that you are providing a product that is easy to administer, and the patient-friendly formula creates virtually no sensitivity. Plus, we will teach you how to make whitening a profitable part of your practice. We will show you how to increase revenue while bringing in new patients and creating a buzz about your practice. You will also enjoy ongoing residual sales of maintenance products. On top of these advantages, you'll also love no damming, no sensitivity, no refrigeration, free proven marketing materials, lower price point than other whitening systems, virtually no labor required, and the fact that Bleach Bright Pro produces ongoing residual sales, plus a 100% satisfaction guarantee. Now that we've reviewed the benefits of Bleach Bright Pro, let's go over how to effectively market Bleach Bright Pro to maximize your profit and new patients. In order to make Bleach Bright a profitable part of your practice, we have created a proven marketing protocol that will ensure your success. As soon as your Bleach Bright Pro system arrives, be sure to set up all of the marketing materials before offering Bleach Bright Pro to your patients. Hang a poster in the waiting area and each treatment room. Place the sign outside the office, in the front lobby, or wherever it is most visible. Hang a window cling on the exterior window or on the appointment window. Instead of paying for 6-month reminder postcards, Bleach Bright will provide them for free. The free cards will save you money, bring in new patients, and increase your business. Have all staff wear the buttons to create a dialogue with patients. Use our proven marketing disc for printing professional custom templates for holidays, special promotions, and sales. Or you can use the logos, stock photos, and product photos to create your own marketing materials. Of all the marketing materials, the most proven and effective by far is the Tri-Fold brochures. This will be your best sales force when you are busy attending to other tasks. Each time a patient comes in for an appointment, hand them a brochure when they sign in and tell them that this is a new and exciting service that your office is offering. By giving the patient the flyer at that time, there is a much better chance of them reading it than if it were handed to the patient on their way out. Remember, just having the product is not enough to sell it. Teeth whitening is in high demand, but if your patients do not know what you offer, how do you expect them to purchase it? So be sure to follow our marketing protocol and display the products to maximize your revenue and new patients from whitening. Now that the marketing materials have been set up, it's time to start selling whitenings. Before performing the whitening, ensure that the patient is in relatively good oral health and not perio involved, exhibiting failing restorations or is otherwise in an unhealthy oral state. Review the expectations a patient should have. Most patients will see a 6 to 8 shade improvement on the in-office whitening, but anatomy, calcifications, age, teeth condition, and hygiene all play a part in determining the results each patient will attain, so there is no way to accurately predict the results. After reviewing the patient's oral health and expectations, it's time to start the whitening. Place the retractor in the patient's mouth to retract their lips. Then use suction or gauze to dry the surface of the teeth. Make a note of the patient's starting shade before the whitening. Ensure good lighting when shading teeth for the best result. When shading teeth, if grade falls between 2 shades, be conservative. Apply vitamin E to the top and bottom lips and gums. This will act as a barrier between the gel and soft tissue. Now you're ready to apply the specially formulated whitening gel. Our proprietary whitening gel is similar to other chairside whitening products, but better because of 3 exclusive ingredients. Potassium nitrate is used to prevent sensitivity, eliminating the need for damming. It also acts as an additional oxidizing agent with the peroxide. Photoinitiator works with the hydrogen peroxide and light to expedite the breakdown of the hydroxyl radicals, producing a quicker result. Xylitol is FDA approved and highly recommended for its ability to prevent cavities. To apply the gel to the teeth, start by replacing the cap on the black syringe with the micro tip. Then apply a thin layer of whitening gel with the micro tip to each tooth individually. Avoid the soft tissue when applying the gel. If any gel gets on the tissue or lips, clean it off with a swab before proceeding. Place the goggles on the patient's face to protect their eyes from the light. Now it's time to apply the LED light for 15 minutes. Turn the light on by pressing the on-off switch in the center of the head. When the screen lights up, press Enter. Set the light to 15 minutes. Press Enter again and apply the light to the patient's mouth. The light should be placed about 1 inch away from the teeth. After the first 15-minute session, clean and dry the teeth with suction or gauze, then repeat the same process. Reapply the vitamin E, whitening gel, and light for 15 more minutes. After the second session, again use suction or gauze to dry the teeth, then remove the retractor. Now it's time to compare the results to the starting shade. Use the shade guide again to determine the ending results. Be sure to shade the patient in the same light you shaded them in originally to ensure consistent results. When shading teeth, if grade falls between 2 shades, be liberal. Be sure to express your excitement when the patient is done and compliment them on how white their teeth look. Give the patient a mirror to look at their bright new smile. Explain to the patient that maintenance is vital to keep their new smile bright. Tell them to avoid dark-colored food and beverages for 24 hours and to apply the whitening pen 2 to 3 times in the first 24 hours to gain additional results. Give them the maintenance products and instruct them on how to use them properly. It is vital to promote the continued use of maintenance products by the patient to drive residual sales and help maintain the patient's new white smile. Now that we have reviewed the protocol for the Bleach Bright Pro in-office whitening, it's time to review the Star Bright Pen and Home Whitening System. The Star Bright Pen is a 2-sided pen with Bleach Bright's exclusive whitening gel on one end and an enamel strengthening formula on the other end. The whitening gel works great to maintain the tooth shade achieved by the LED whitening at home or on the go. The enamel strengthening gel works to repair the enamel over time and acts as a protective layer over your teeth to prevent staining throughout the day. It fits in your pocket, purse, car, or desk and can be used anytime, anywhere. But for best results, it is recommended that you use the Starbright pen twice daily after brushing your teeth. Using the Starbright pen is simple. Just smile wide and paint the specially formulated whitening gel onto each tooth individually. Continue to smile for 20 to 30 seconds to allow the gel time to dry. Then repeat the same steps with the enamel booster gel. Your patients will love the results of the Starbright pen. The Home Whitening Mouthpiece is a weekly maintenance item that is designed to assist your patients in maintaining the shade achieved with their in-office whitening. They will receive a one-size-fits-all custom mouthpiece, a protective case, and a syringe. To prevent relapse and continue whitening, have the patient begin by using the Home Whitening Mouthpiece twice in the first 48 hours. For continued expert whitening, recommend to the patient to purchase the refill syringes and use for the next 12 days for a minimum of 1 hour, not to exceed 3 hours. To use the Home Whitening Mouthpiece, have the patient bite down on the custom moldable tray to form an impression of their teeth. After forming the impression, show the patient how to insert a small dot of gel into each tooth structure. Be sure to tell them not to overfill. Overfilling will result in excess gel getting on the gums, which can cause sensitivity. After filling the tray with gel, tell the patient to insert it into their mouth and leave it in for a minimum of 1 hour, but not to exceed 3 hours, assuming no discomfort. After the time is up, tell the patient to remove the tray from their mouth and rinse with water. Also, rinse the tray with water to clean it, then put it back in the protective case. Recreate the impression before each use. By using the Home Whitening Mouthpiece weekly, your patients will be able to maintain their brilliant white smile forever. Upon completion of the patient's initial supply of gel, recommend to the patient to return to your office to purchase the Bleach Bright Pro refill syringes. This will continue their whitening and allow them to achieve the best possible rates. Begin bringing in new patients today with Bleach Bright Pro. Call 866-700-3772 or visit us online at www.bleachbrightpro.com.